My project was on the benefits of joint attention therapy in children with autism spectrum disorder. So first, I should begin by explaining what joint attention is. So it's the ability to share a common focus with someone else. So whether that is a person, an object, a concept, an event, it's sharing that with somebody else. So it involves the ability to gain, maintain, and shift attention. It's very important in the development of autism, and lack of it could be one of the earliest signs of autism spectrum disorder. And these skills relate to outcome in therapy as well as in natural environments. The skill of joint attention can be present, typically in the first 6 to 12 months, but anywhere from 6 to 18 months, it typically is developing. So it involves three main things, and that's attention, emotions, and intentions. So we kind of talked about attention already, but that's when two or more people are paying attention to the same thing. Emotion, that's once again when two or more people can share an emotional state. And intention, it's when two or more people, they're trying to accomplish the same thing and they know that they are in it together, they're doing it together. Joint attention, social development, and communication. So being able to gesture, verbally speak, link meaning, and know when someone's trying to talk to you, they all link together. So first, interaction, that leads to listening. Listening leads to understanding language. Understanding language then leads to using language, which overall leads to talking. When there's no joint attention, there may be difficulty understanding certain looks or certain gestures by communication partners. If mom gives a certain look and says, "Don't do that," they might not be able to read that or to understand what that means. This can overall lead to dangerous situations because they may not be able to verbalize or gesture, use eye contact. They might climb on things they shouldn't. They may not respond to their name. They can't ask for their wants, their needs. That can lead to developmental delays overall. So moving on to possible red flags. So these are just some things to look forward when a child, you might be concerned if they are showing these. So the child might present immature ways to gain attention rather than saying, "Mom, I'm hungry, I want food," and pointing to something. They might start crying, throwing a tantrum, start whining about things. They might have difficulty maintaining attention. As we talked about, they might not respond to their name or verbal direction. Inconsistent responses to words, gestures, actions. All of these may be things to look out for if there is no joint attention present. Moving on to examples of joint attention skills. So a coordinated joint look, showing, giving to share, pointing, following point, and following gaze. So in this picture in the bottom right corner here, you can see that this adult is looking at this object, which the baby is successfully looking at the object as well. So they are able to understand that the adult is looking at that, and then in turn, they do it as well. Following point, so up here in the top right corner, you can see the mother is pointing. It could be an airplane, something in the sky, or a train, things like that. But the mom is pointing, and then you can see the child is following the point, following successfully. You can see the child is pointing. These are all examples of joint attention skills. Moving on to, these are examples that parents or family members, teachers, anyone can do, and then have the child also do to gain that joint attention skill. So I won't read all of these, but when mom or dad, you are reading a book, you can point to pictures and you can say, "Oh, look, the green train," and have the child point to the pictures as well. You're both attending to the book and the certain objects that might be shared. Drawing a picture, same thing. The child can watch the drawing. They can point to things in the picture as well. Peekaboo with a towel. So this one's a fun one. But you, as a parent, can, do peekaboo and have the towel, and vice versa. The child can giggle, they can respond to that, and then you can switch roles. So then the child would say peekaboo, and then you would respond. So that's getting that interaction and going back and forth, turn taking with that. So there's lots of different examples. Another fun one is singing a song and then using gestures, having the child model those back, and you two are both engaging in that activity. So there are many, many benefits to incorporating joint attention into a child's daily routine. But overall, like we've talked about, it increases the development of social interaction and performance skills. It improves engagement. And then there are two types of joint attention skills. So there's imitating and then there is responding. So as you can see right here in this first picture in the top left-hand corner, the child is responding to the adult pointing. So the adult points and then the child is attending to what the adult is pointing to. And the other four pictures, so the top right and then the bottom three, you can see the child is imitating. So they are initiating that where the child is pointing, everyone else is looking, the child is looking at this object, looking away to the adult, and then looking back to that object. So attending to the object, away, and then back at it. So those are all great examples of joint attention. Why should you do this? Once again, it's really easy to develop these skills if you practice them across multiple environments. So using age-appropriate toys, there are lots of different toys that can be used. It increases the understanding of others to overall get those social language and cognitive skills. So what can you do? These are more examples. So blowing bubbles is a fun one. One blows, the other one pops. Otherwise, tossing a beanbag back and forth. These are lots of different examples. And then these are helpful websites and handouts that can be accessed by parents, caregivers, teachers, if there are any more questions. And then these were my references.